Hi guys, I'm Nabiha, fourth year student of Surgical Technology from Dow. Today in this video, me and my team members are going to brief you about some of the emergency drugs, their purpose, their action, how do they work, indications, contraindications, and adverse effects. So basically, what is emergency drugs? These are the chemical compounds used in patient during life-threatening conditions which need immediate care so that the symptoms can be controlled and the life of the patient can be saved. Why we are using it? To save the life of patient, to normalize the vital body functions, to divert the patient from possible risk, to control the symptoms of disease in patient, to provide initial treatment for the illness. For the drug to be useful in emergency, it must have onset of action and to be administered in such a way as it shows rapid onset of action. These are some emergency medicines that we are going to cover in this video. First one is the atropine sulfate, second adrenaline, third phenylephrine, fourth diazepam, fifth hydrocortisone succinate, and the sixth one is the naloxone. Let's get started with our first emergency medicine, that is atropine. Atropine is a core medication in the World Health Organization essential drug list, which is of minimum medical needs for the basic healthcare system. Its generic name is atropine and tetrarin. Its brand name is atropine sulfate. Route of administration is mouth, intravenous, intramuscular, and rectal. In emergency, we majorly use atropine to treat bradycardia. Atropine belongs to the class antimuscarinic drug or anticholinergic drug, competitive antagonist for the muscarinic receptors, the receptor which involved in parasympathetic nervous system. So it inhibits the effect of parasympathetic nervous system, specifically choline, acetylcholine. Acetylcholine is predominant at rest, is the chief neurotransmitter of the parasympathetic nervous system that contracts smooth muscle, dilates blood vessels, increases bodily secretions, and slows heart rate. So what atropine does when it is administered, it inhibits the effects of parasympathetic nervous system and increases the heart rate, decreases the gastrointestinal and respiratory secretions, and also causes bronchodilation. Dosage. What should be the dosage given in emergency? 0.02 mg per kg should be given. In cardiac arrest due to bradycardia, whole 1 ml ampule is given. Large doses like 2 to 4 mg per kg may be required for organophosphate poisoning patient. Indication. To whom it should be given? Firstly, it used to treat bradycardia. Second, we can use it in we can also use it in cardiac patient, but cautiously. Third is to treat bronchial secretions, to prevent bronchospasm, used in patients with hypersalivation, and to treat organophosphate poisoning. Contraindications to whom it should not be given. First, tachycardic patients. Second, hypersensitivity of the drug. Third, glaucoma, urinary tract obstruction, and GI obstruction. Adverse effects due to atropine, patient may face headache, or it can lead to tachycardia, palpitations, constipation, urine retention, pupil dilatation, and dry mouth. Our next emergency medicine is phenylephrine. Phenylephrine is a direct-acting adrenergic drug that binds primarily to alpha-1 receptors, means it is alpha-1 agonist. Alpha-1 receptors may be found on vessels. When phenylephrine binds to them, their efficiency of work increased, which causes vessels to constrict, which further leads to increased blood pressure. Phenylephrine decreases heart rate. Dosage of phenylephrine is 1 to 2 microgram per kg. Indications of phenylephrine: hypertensive patient, used as a nasal decongestant in sinusitis, rhinitis. It is also used in pupil dilatation condition called mydriasis. Contraindications of phenylephrine are hypertension and hypersensitivity. Adverse effects of phenylephrine: large doses of phenylephrine may cause hypertension, headaches, and bradycardia. It is very important when you give phenylephrine to the patient, you must monitor the vitals of the patient continuously. Our next emergency medicine is adrenaline or epinephrine. Epinephrine is a direct acting agonist to adrenergic receptors. Basically, adrenergic receptors are found all throughout our body. Administration of adrenaline enhances their activity or their response. Adrenergic receptors are the targets of epinephrine. When epinephrine administered in body, it interacts with both alpha and beta receptors. High dosage of epinephrine acts on alpha receptors, causes vasoconstriction. Low dose acts on beta receptors, causes vasodilation. Dosage of epinephrine is 0.01 mg per kg. Indications of adrenaline are: it is used to restore cardiac rhythm in cardiac arrest patients. It is used as anaphylaxis, means to treat severe allergies. It can also use as bronchodilator. It can also use in asthma patients. Contraindications of epinephrine are hypersensitivity of the drug. It is contraindicated in glaucoma patient. It is contraindicated in anesthesia with halothane. Adverse effects of adrenaline or epinephrine are tachycardia, restlessness or nervousness, palpitations, and angina. Our next emergency drug is hydrocortisone. It is an anabolic steroid drug of corticosteroids. When we are talking about corticosteroids, we should know what is corticosteroids first. Corticosteroids are basically steroids that produce in the adrenal glands, specifically produced in adrenal cortex, outer region of adrenal gland. Corticosteroids further divided into two main classes, that is the glucocorticoids and mineralocorticoids. Each of them has their own effect in the system. Hydrocortisone comes, these both classes comes in hydrocortisone. So glucocorticoids reduces the inflammatory reaction by blocking the inflammatory mediators that causes inflammation and causes immunosuppression. Mineralocorticoids effects which increases sodium and water retention, due to which blood volume increases, which leads to the increased blood pressure. Indications of hydrocortisone: it is useful for inflammatory and immune system disorders, severe allergic responses. It can also be used in dermatitis, ulcerative colitis, rheumatoid arthritis, adrenal insufficiency as a hormonal replacement therapy. Its dosage is 100 mg to 500 mg. Considerations: it should not be given to premature infant, cardiac disorders, liver disorders, systemic fungal infection. Adverse effects of hydrocortisone: it can further increase blood glucose level if the sugar levels not monitored properly. It can increase fluid retention. it can lead to hypertension, it can cause convulsion, it can also cause Cushing syndrome. Means by taking a steroid, increase body weight, abdominal distension, hypokalemia, susceptibility to infection, especially wound infection. And the last is the osteoporosis due to decrease in bone density. Another emergency medicine is diazepam, which belongs to the class of benzodiazepine. Diazepam trade name is Valium, which is commonly known. It acts on GABA A receptor by binding with allosteric site, so that inhibitory GABA can bind to GABA A receptors and increase the opening frequency of chloride channels. This opening leads to increased conductance of chloride ions, which due to chloride negative ions produce hyperpolarization. So in CNS, cell undergo hyperpolarization instead of depolarization, which results in the inhibitory effect. Means it induces neural inhibition, which results in sedative action. What's important to remember about delirium? That it is depressing our central nervous system. Its therapeutic classes are anti-anxiety, anticonvulsive. It can be used as pre-op sedation, conscious sedation, treatment of seizures, insomnia. It is also used in management of alcohol withdrawal syndrome. Because in alcohol withdrawal patient we can see delirium, tremor, agitation, and diazepam can treat this. Dosage of diazepam is 0.05 mg per kg to 0.1 mg per kg. Contraindications of diazepam are hypersensitivity, children less than 6 months, breastfeeding, child, sleep apnea, hepatic dysfunction, and renal impairment. Adverse effects of the drug are hypertension, fatigue, respiratory depression, blurred vision, headache, drowsiness, slurred speech. And the last one is the naloxone. Naloxone is a competitive inhibitor of the opioid receptor. Means it inhibits the opioid receptor, reverse the action of opioid overdose. Its route of administration is intravenous injection, intramuscular injection, subcutaneous injection, and it is also used in intranasal spray forms. Indications of naloxone are: it is primarily used to reverse the effects of opioids overdose. Naloxone injection is also used for surgery. Is used after surgery to reverse the effects of opiates given during surgery. It can restore normal breathing within 2 to 3 minutes in a person whose breathing has slowed or even stopped as a result of opioid overdose. Contraindications of naloxone: allergic to it is contraindicated on those patients who are allergic to naloxone or any of its component should not be used in medication. Adverse effects of naloxone: nausea, vomiting, sweating, headache, and rapid heartbeat. In rare cases, it can cause seizures, pulmonary edema, or cardiac arrest. Dosage of naloxone should be given is 1 to 2 microgram per kg.